Most students don't know the management plan for a stroke, which is basically a clot in the brain. So when a patient comes with stroke, you first check the time span. If the patient comes after 24 hours, now it's not that of an emergency, you go for standard treatment. The standard treatment is antiplatelet, for example aspirin, and then you look for the cause of this thrombus or embolus basically. So you can look for deep venous thrombosis or things like that. But if the patient came within 24 hours, now you go for CT angiography of head and neck. In CT angiography, if you find a clot, which is basically causing a large vessel obstruction, you will go for thrombectomy, which is surgical removal of that clot. But if you find that there is no clot found, again you go for the standard treatment, which is antiplatelets and finding the source of embolus. You must be thinking, what about the thrombolytics? Do we use them or not? So yes, if the patient comes within 4.5 hours, you may consider thrombolytics before this CT angiography and all. It is highly effective in the first hour after stroke, but you have to consider some points, some contraindications before giving the thrombolytics. These contraindications can be memorized with the mnemonic BIG SHIP. So B stands for blood pressure. So blood pressure must be less than 185 by 110. Then I stands for ischemic stroke. If there is a history of ischemic stroke in the previous 3 months, you cannot give thrombolytics. Then G stands for glucose. Glucose level must be more than 60. Then S stands for surgery. If the patient had some recent brain or spine surgery or there's some kind of malignancy or neoplasm, you should avoid these thrombolytics. Then H stands for hemorrhage. So if you suspect a subarachnoid hemorrhage or a patient has intracerebral hemorrhage, you cannot give thrombolytics. Then I stands for INR. So you must see if the patient is taking anticoagulants, the INR must be less than 1.7, and then the PT, PTT, all of them must be normal, and then you can give thrombolytics. And then the P stands for platelets. The platelets must be more than 100,000, and then you can give a thrombolytic such as tenecteplase. So I hope you like the video, and now you can solve this USMLE question.